A very good morning to everyone. Under the aegis of ICMR Advanced Center for Evidence-Based Child Health, we are conducting a one-day online workshop on health economics. I would like to extend a warm welcome to you all. As the agenda messaged, we have a list of eminent speakers for today, and it will be an enriching talk for all of us. I would now like to request our principal investigator, Professor Meenu Singh, to extend a welcome to everyone. And she's also the first speaker for the talk, which will introduce us to the concept of health economics. Welcome, ma'am.
Thank you, Dr. Noor, for organizing this workshop on behalf of ICMR Advanced Center for Research for Evidence-Based Child Health. As you know, good morning to all the participants, and I can see quite a number right now. Uh, as you can see, we all are not health economists, and same as, myself. We have just been learning about it in the recent years when we have started applying some of the economic principles of economics to health. And we are trying to make our health services very, very cost effective. We are in the midst of a pandemic, and several of the examples which will be discussed in today's deliberations will pertain to the pandemic which is going on and how the health services have been geared up to meet with the challenges and how cost effective some of these strategies are likely to be. So, I will just give you a brief about the main principles which are used for in the practice of health economics. We have several other participants, faculty who are authorities on this. We have Professor Shankar Prinja and others who will be talking in greater detail about this. So I would now like to share my screen. Um, is it visible, Dr. Noor?
Yes, ma'am, it is.
Okay. So these are, I'm just going to talk about some of the principles which are involved in health economics. Economics, as such, it's a discipline which deals with wealth creation, and it also deals with wealth distribution and wealth utilization. And it's always, something which is always there in our minds that wealth gets more wealth. And if we invest properly on health, we are likely to accrue more health, and this health will then transform into wealth. And wealth is measured in economics in terms of money and rupees or dollars or whatever. So in health economics, we are trying to convert each and every benefit which is going to come from investment in health in terms of how much money one can make out of this, or how much money has been made out of this. Okay, so some of the slides have been taken from internet sources. I have no conflict of interest. And the contents of this talk are, we will be uh, there will be an introduction to the health economics. Why do we need health economics? Then we talk about macroeconomics and microeconomics. These are some of the terms which are very commonly talked about in planning circles. And then we have uh, health economic evaluation as to how we evaluate a particular strategy or a particular intervention in terms of health economics. Now, this is the economist view of the world. If you see a bottle which is half filled and half empty, the pessimist view will be that the bottle is half empty. The optimist view is that the bottle is half full. But the economist view will be that the bottle is half wasted. So, waste is in terms of material waste, which could be in terms of waste of contents which are there in the bottle, and it could also be related to the cost of the contents which are there in the waste. So now, what is health economics? Uh, Health economics is a branch of medicine, you can say. Of It's also can be considered as a branch of economics, which is concerned with the efficacy, effectiveness. Just a moment, I am having a little problem. Yeah. So, health economics is that branch of economics which is concerned with the issues which are related to efficiency, effectiveness, value, and behavior in production and consumption of health and healthcare. So there are several terms which have come in this, which are efficiency. Efficiency, as you know, is something which saves energy, and saving energy means saving money. Effectiveness is an impact as to how much a particular problem has been taken care of by a particular intervention, and then its value and behavior in the production and consumption of health and healthcare. That means ultimately this leads to modification of policy, modification of practices, which would lead to better healthcare and better health of the population. So, health economics further includes the study of how healthcare and health related services, their costs and benefits, and health itself are distributed amongst individuals and groups in the societies. So it is not just applicable to one group of the society, but it is something which also encompasses universalization of practices so that all individuals who are there in the society get the best benefits out of it. And that is what is known as equity. In simple words, it is the study of all the financial aspects of healthcare system. And now, just to tell you how health economics impacts different areas of health. For example, health and development. I mean, these are some of very commonly used phrases which are used in day-to-day practice whenever we are talking of public health or we are talking of other health interventions. We know that health leads to development, and development means, in terms of economic terms, when you are gaining something in terms of your income, or you are gaining something in terms of your lifestyle, or in terms of education. So, health actually can lead to development because health accrues benefits in terms of better productivity, and that leads to development. Then we come to financing of health services. We know that health services, nothing comes for free. And if you have to provide a service, you would need some amount of money to run it. And that is what is financing. Now, financing of health services, as we know, it comes from two sources. It may come from public sector, it may come from private sector. In public sector, we know that every year there's an allocation which is made for health, and that gets transformed into development of health services. And that financing is measured or is estimated by the requirement of the population for this kind of services. Many times the governments are able to meet those requirements, but many times they're not able to meet those requirements. And these requirements can be in terms of materials. For example, this could be in terms of hospitals, availability of medications, availability of beds, availability of staff such as doctors, nurses, and other paramedical people. And for that, you need, if you want to provide all these resources, you need to have financing. And that becomes the crux of the matter many times, that it is actually financial allocation to health which determines what is the type of or the quality of health services what a country is likely to have. Then we have something which is very important, and that is economic regulation in health. We know that whenever we are investing in health, we want to see whether whatever investment has been made, that is paying dividends or not. And for that, you need to have some regulation, you need to have some vigilance. You want to see whatever the sources were allocated, whatever resources were allocated for a particular function, whether they are being used there or not. And that is why we have various agencies which regulate the economic resources in health. It all also determines the allocation of resources. For example, if a particular intervention is likely to accrue more benefits in terms of health, then it's very pertinent to allocate resources to that. You know, in the midst of COVID epidemic, everybody is talking about why public health development has been lagging behind in India. And one always feels that we should allocate more resources to public health so that we are not just caught unawares whenever something, a malady strikes us. And we should have some kind of readiness, some kind of preparedness to meet exigencies in health which are there. So allocation of resources to relevant systems has to be made, and that is also determined by economic evaluations of health. Again, efficiency of health services is very important, which has to be judged by the cost effectiveness of interventions which have been made, how well the resources have been used. So all these terms are ultimately leading to a concept that we should be having more benefit out of lesser investment in areas of health. Now, it concerns quantification of resources used in health service delivery over a period of time. Health economics also concerns efficiency with which resources are allocated and used for health purposes. So, whenever you are going to do an economic evaluation, you will have to find out how much are the resources which are being used in that particular field as far as health service delivery is concerned. And time is also a very important factor in that, as to what is the period for which those resources have been allocated or they are being used. Similarly, efficiency, that means whether you have more output from a lesser input, is something with which resources are allocated and used for health purposes. That means if you have lesser investment but we have more benefits. For example, if you have, uh, when we talk about diseases, is prevention better than cure? We know that sometimes prevention of, say, for example, an infectious disease, prevention of an infectious disease can take place with much less investment than the treatment of the infectious disease. We know in terms of COVID, if you have masking, social distancing, sanitation practices, they prevent the disease. But once the disease occurs, it accrues much more cost. The patients have to be hospitalized, they need oxygen, they need expensive drugs. So, efficiency with which the resources are allocated and they're used for health purposes is also very, very important. Then we have something which, when there is effect of various health services upon health and well-being of the population. So that also has to be considered. For example, if you have a private health system, you have a public health system, and then you have to check what is having a better effect on the health and well-being of the population. Of course, the costs will be more in private setup, but maybe some services also may be available there, which are not there in case of public health systems. So all those have to be weighed against a certain yardstick, and those are known as the indicators, which ultimately tell us as to what system is having a better effect in case of health measurement. So, what are the types of economic problems in health sector? So, first thing is, at what level should hospital fees be set up? For example, you set up a new hospital, you have employed a number of doctors and nurses, and now you want to see whether your system will run into profit or not. So, what should be the hospital fee? We know that hospital fees vary so much amongst the private and the public sector hospitals. In public sector hospitals, also, hospital fees have to be at a certain level because most of the services are government aided in the government hospitals, and that is why the hospital fees are less. But that doesn't mean that expenditure is not taking place in those hospitals also. So, cost effectiveness is important even over there. Then let us look at certain common practices. Are taxes on cigarettes a useful way of promoting health through reducing the prevalence of smoking? So we know that whenever there are taxes on tobacco products, the government loses exchequer on whatever they would have got on these products. But then by doing that, they are preventing a large number of consumers from using cigarettes, which sometimes becomes a habit, and it leads to several health effects. It may lead to respiratory diseases, it leads to hypertension, heart disease, which again becomes a cost to the government. So, what is a better strategy? Not to have cigarettes going around, or keep treating diseases which are caused by cigarette smoking. So these are also benefits and risks which have to be shown to the policymakers and also to the public, actually, to the consumers, that this is why a particular decision is made. Then there's a question about what is the more effective method of increasing the take up of health services, price control or subsidies. Now, this is something which is very commonly discussed when you have, states asking for more money for starting certain health services. So, the government usually asks for price control or subsidies. Whether why we should give subsidies to certain things. For example, a lot of agricultural products in Punjab are, they ask for subsidies for fertilizers and all that, which leads to, say, better crops, which may lead to farmers becoming richer. But whether it really transforms to health benefits is something which we don't really know. Then, how should doctors be paid, and how much should the doctors be paid? That's a cost which you are putting on the services of a physician. Sometimes as you might have seen in some of the private hospitals, where the doctors, super specialists, are paid much more than the general, lower level or general physicians. As the qualification increases, the cost of a doctor goes on increasing because his ability to perform specialized procedures also increases. So, this is one yardstick which is used for pay being given to the doctors. Of course, some additions are also made when the age increases or the experience increases, because even the general physicians, once they have become more experienced, they are likely to get more pays because they are likely to make decisions which are better. Then there is something like which is related to interventions. Which treatments are most cost effective for people with COVID-19? We know that we these days we are talking about COVID-19 being managed at home. We know that at home you are not supposed to give a lot of interventions which are otherwise being given to these patients. And it is quite likely that many of the interventions which are being given in the hospitals are not required by the patients. And if they can be treated at home, the treatment may become much more cost effective for people. I mean, they may be saved of several side effects of medications, and they would also save on the cost of medications which are being used. So, why do we need health economics? Of course, as we said, to formulate health services. We also to establish the true cost of delivering healthcare. And it's actually the true cost. True cost means that it is not just how much investment has been made in building a hospital, or starting a facility, it is also about delivering healthcare to people. That means how many people who are visiting are actually benefiting from that facility is something which needs to be estimated. Similarly, to evaluate the relative costs and benefits of particular policy options, for example, right now we are thinking whether to vaccinate the whole population. That will be an important strategy to save lives, or continue with the way a pandemic is continuing and let the people just acquire herd immunity. So you may be saving on vaccine, but then you may be wasting a lot of money on care of these patients who are becoming sick. So relative costs and benefits of a particular policy are also very important. Then to estimate the effects of certain economic variables on utilization of health services. For example, certain economic variables like how much is the investment in health, what is the GDP, how is that going to affect the utilization of health services is also which comes in the purview of health economics. Now, again, investing in stronger health systems could add up to 8.5 years. This was an estimate by the World Health Organization for Sustainable Development of Goals in Health. And it shows that if you invest in stronger health systems, the life expectancy increases. And this has been calculated, by the health economists by using various indicators. We know that countries are facing a financing gap of up to $54 billion a year. And this gap has now increased because of the COVID pandemic, to achieve the SDGs or the health targets. At the moment, nobody is talking of SDGs. People are only talking of COVID and how to prevent mortality and morbidity because of COVID. And you can really see how far behind the health of this global health has gone because of the pandemic, and what will happen, say, 5 years from now, when all other diseases would have lost control in our global scenario. We know that 85% of the cost of reaching the SDGs health targets can be met with domestic resources. And so it is very little that one has to borrow from other countries or from other systems. But now, of course, with the altered scenario because of pandemic, I think it may not have been 85%. At the moment, we are all talking of global health. We are talking of cooperation amongst countries so that we can achieve better health targets for our population. So, investment in health could prevent about 97 million premature deaths by 2030. This is an estimate again from the WHO, and we know that. But a lot happened. A lot went haywire when the pandemic came, and because we had not invested in the health systems, we could not prevent this epidemic from occurring, which has actually happened right now. So, what are the economic goods in healthcare? One is health and medical care, which itself is an economic good. Health as a private or a public good is another concept, whether who should be responsible for maintaining health of the society. Then our measurement of health. That means how do you measure health by various indicators? For example, long life could be one indicator, healthy life could be another indicator, being free from diseases could be another indicator. So, all these indicators would need to be set so as to measure the health in our system, because only then we can use this as a tangible uh, parameter on which we can calculate things. Then investment aspects of healthcare industry have to be seen. Then burden of diseases, which disease has more burden and that would need more investment. Effect of healthcare provision, whether we have seen that if you invest in health, the life increases. So that is the effect of healthcare provision. And then choice of technology in healthcare systems. In the recent times, one has seen a lot of investment in technology for improvement in healthcare systems, be it vaccinology, be it telemedicine, be it discovery of newer diagnostic.
Diagnostic test.
So choice of technology is extremely important. Now, what is the relevance of all this economics in our day-to-day life, or in making policy for the populations which affects their day-to-day life? So that relevance can be direct or it can be indirect. The direct relevance would be to clarify the choices for health policy. It would also help about choosing amongst different health services, decide what to buy and how to pay for it. For example, recently the government had to buy a lot of vaccine, they had to buy a lot of ventilators. So, where to invest more would be actually determined by the health economists, what is likely to have more benefit in the population. And then to evaluate the end result of such consumption is another parameter of which the relevance has to be seen. Indirectly, the decision between out-of-pocket payment or insurance is something which can be considered, and similarly, population health and welfare are other indirect indicators. Now, coming to macroeconomics and microeconomics. Macro, as you know, is something which is large, which is holistic, which affects a larger segment of society or maybe the population as a whole. And that is something when we are talking of, say, our union budget, when it is being announced, it's, something which studies how an overall economy will behave, the market system that will operate on a larger scale. So, macroeconomics studies economy wide phenomena such as inflation, price levels, rate of economic growth, national income, gross domestic product, and changes in the unemployment. So, these are bigger parameters which are assessed whenever we are judging the performance of, any society in terms of macroeconomics. Now, microeconomics is social science that studies the implications of incentives and decisions, specifically about how those affect the utilization and distribution of resources at individual levels or household levels or a firm level. So, if a government makes a policy about, energy, so energy conservation is one very important, decision which can be related to macroeconomics. But how it affects a household, how energy utilization, say from LPG or from solar energy, how that is going to affect the dynamics of a household and also the economics of that particular household is microeconomics. So, some of the concepts which are basic to health economics are the concept of efficiency, the concept of equity, and I would like to explain these concepts a little bit in detail. Concept of utility and cost, concept of opportunity cost, and concept of marginal cost and benefit. So, if we look at efficiency is something which gets most out of the scarce resources. As I said, if you invest less and get more, then it is a concept of efficiency. I think this must have been aptly clear to you. Then comes the concept of equity. Now, equity stands for social justice or for fairness. That means the distribution of resources has to be according to the needs or demands of that particular segment of the society. If you look at this picture, there is a match going on, and there are three individuals. There is a wall in between, and there are three individuals who have to watch the match. In the first image, it is assumed that everyone will benefit from the same support. They are being treated equally. Although they are being treated equally, but this person is not able to see anything. This person has to make a lot of effort to see. Or with this person, it is okay. Although same amount of allocation has been made to all of them. So, it's like they are being treated as equal. But in this image, if the individuals are given different supports to make it possible for them to have equal access to the game, they are being treated equitably. For example, this person can do even without a support. This person is just taking one support, and this person needs two blocks to support him. So here the allocation of resources is being done on the basis of equity, the equitable distribution of the resources. But there is something else which can be done and which is more systematic. That means if you remove the wall, if this particular obstruction is not there, and all three can see the game without any supports or accommodations because the cause of inequity has been addressed. So many times in social sciences, it's very important that you address the cause of inequity rather than trying to address things with the help of resources. Although this cannot be done all the time, but uh, many times it can be done, and that is why the policymaker has to be have a vision to see things in a broader daylight. Okay, now let us come to the concept of utility and cost, or cost and utility. Utility is the economic term for satisfaction which is obtained from purchasing a particular good or service. And cost originates from constraints in our resources. So what is the concept of opportunity cost, which is equal to the next best alternative for one? If you look at this picture, on this on the x-axis, it is the number of hours of study. Let us take a student who has to study for say examination, and this is the number of hours. This person is studying 2 hours, and later on he starts studying 4 hours per day. But then on this side is the cost. The cost is the hours of leisure or playtime or anything else which a person wants to do when the student is not studying. So earlier, this person was having uh, more hours for entertainment or more hours for leisure. But then, with the increase in these 2 hours, this had to come down to 8 hours, from 12 hours to 8 hours. So that is the opportunity cost, which is actually the next best alternative for home. So this is how it changes with each opportunity cost. We tend to have the next best alternatives which have to be given up. Now, what is the concept of marginal cost and benefit? Economists define the marginal cost of an output to be the additional cost incurred in producing the last or next unit of that output. So, the marginal cost will be the additional cost over and above what this cost is currently being used, and the marginal benefit again will be the additional benefit which is obtained by consuming the last unit of an output. So marginal benefits are something which one has to invest extra, and marginal benefit is what one gets extra from the consumption of the that unit of the output. So what are the steps of economic evaluation whenever we are taking up economic evaluations for our studies? So first we have to decide upon the study question. The studies question should be relevant, it should be valid, it should be the question should be unequivocal. There should not be too much of vagueness in this. Then is the assessment of costs and health effects of that particular intervention, if it is an intervention or exposure. Of course, we have to make adjustment of timing, because time is another very, very important resource, which is equal to, as we say, time is money. So whenever we are investing more time in something, we are actually losing money. So timing is also very important. Then adjustment for uncertainty has to be made, as we know that many times there are so many variables which are there when we are measuring an intervention. There may be so many co-interventions which may lead to uncertainty about a particular assumption. So that has to be decided. And then we have to make a decision. Uh, so the types of economic evaluations can be cost minimization analysis, it can be cost effectiveness analysis, it can be cost utility analysis, and it could be a cost benefit analysis. So the things which are varying in this are, it could be minimization means making it more efficient, effectiveness again having better effect, utility means better utilization of that effect, and benefit means in terms of money, how much are we gaining out of utilization of that particular effect. So, cost minimization analysis could be it compares the cost of different interventions that are assumed to provide equivalent benefits. For example, if there is a drug A and drug B, we want to see how much is the cost the cost of these two drugs, and then see which drug is more effective. So we would then be minimizing the cost of a particular intervention for controlling a particular disease. So here the decision hinges on finding the least expensive way of obtaining the health benefits. For example, if you compare a generic drug with its branded equivalent, sometimes the cost is more, but the effect is similar. Then coming to cost effectiveness analysis, we know that input is there, which means cost. Then there is a process, and then there is an output. Now, for this output to be effective is something which one measures in a cost effectiveness analysis. For example, if you're trying to measure net gain in health or reduction in disease burden from a health intervention in relation to its cost, and sometimes, for example, if you are measuring in terms of blood pressure, for example, there are two drugs which are being used for controlling blood pressure, you will see that how much decline in blood pressure is obtained by a particular medication, and how much is the cost which is being saved because of using if you're using that particular drugs. So benefits are measured in terms of not only just a parameter, for example, an indicator of health such as blood pressure, they are also measured in terms of quality adjusted life years. What is the actual benefit what a person is going to get out of a blood pressure which is well controlled? So that will be interpreted in terms of quality adjusted life years. So then we have cost utility analysis, and cost utility analysis comes after this effect. So we have an output, then we have an effect, and then we come to the impact. That means how much is the impact in terms of change in mortality, change in disability, how much has this reduction in blood pressure helped in reduction of cardiovascular mortality or in reduction of strokes so that disability has been prevented. So all these are proxy indicators which are used, and sometimes that is why we use disability adjusted life years or HALI, that is healthy years or health adjusted life years. So benefits are measured in these healthy years in multidimensional. Sometimes they can be multidimensional when you incorporate quality along with quantity of life, and these are the benefits, QALY and DALI, and you will be explained more in detail about these concepts subsequently. So, QALY is quality adjusted life years. It's a health measure that incorporates quality of life and life expectancy based on average sample of health rating from a group of people and from professionals. So, one unit, that is 1 year full of perfect health, is equal to one QALY. So here, if you look at this particular figure, on this side you have time in years, and on this side you have health-related quality of life. So perfect health of 1 year for 1 year will be one QALY. So, if how much is a quality gain by a treatment given to a patient if he suffers an ailment? If there is no intervention, it may lead to death much earlier than when an intervention has been there. And this difference between the two, endpoints will be the quality gain. That means this person has gained so many years of quality adjusted life years because of that intervention. So, health related quality of life is plotted on a scale of 0 to 1. This is how it is plotted. And the quali was actually developed primarily for cost effective analysis in the late 60s to determine the effectiveness of different medical treatments, technologies, and interventions. And it still has stood the test of time and is still used in measurement of health interventions. Then an opposite of quality is disability. So when something is going down, it would be a disability. Quality will be something when your health is going up. So disability adjusted life years is measured when you have, this is going in the negative. As you see, you saw the quality was going up on the positive. Disability is going in the negative. So the maximum one of disability is when there is, you can say, if there is a loss of one healthy year of life due to death or illness is equal to one DALI. So DALI was developed by World Bank in 1993 to both quantify disease and disability burdens globally and set the intervention priorities. So it actually measures the burden of disease, which is based on a number of years lost from premature death, disease, or disability. So this is just the opposite of what we saw in Quali. So if disease prevention, by a preventive strategy has been there, in that case, the disability may decrease. So instead of a scale of health like QALY, the tallies are related to a degree of disability for a specific disease or disability from none to one. So in the negative sense. Then we come to the cost benefit analysis. When an impact of a particular intervention, we have seen that we were looking at the output after a process, then we looked at the effect,
Actually,
then
YouTube
we
ले
looked
करे पता
at
है
the impact.
ना
And when this impact leads to money, that is
ऐसे
something when we come to the cost benefit analysis. So values this when the benefits are termed in terms of money rather than DALI or QALY, then we call it cost benefit analysis, and this allows for direct comparison between the cost of the intervention and the value of the benefits to see which is higher. And in practice, it is difficult to value health in benefit in terms of money, but many times people try to do that, and that is how you can actually show how much is the money saved by a particular intervention. So this is what you do whenever you are trying to be an health economist. Even if you are sitting in a restaurant, you are looking at the cost of various products which are in front of you. Then you also look at the risks, although risks and benefits are never written on the on the boards, but you should have some concept of what would be the risk of eating a cheeseburger in relation to a tuna salad, and then try to make a choice which is good for your health. So this is all what I had to tell you about health economics.